Hello, you guys. It's Dr. Vidal here at Pure Plastic Surgery. Welcome back to Tuesday Tips. This is our weekly check-in. We discuss different topics in plastic surgery and answer your questions. Because of October, breast cancer awareness month, we have been discussing different topics related to breast. So since this is the last Tuesday of October, we are going to talk about breast again, but a different one. We're going to talk about tuberous breasts. This is a type of congenital breast deformity that restricts the growth of the breast. And why talk about it? Because it's very common actually, and the management can change a lot. So usually people with small breasts think that with a breast augmentation or putting an implant is going to be enough. But we'll discuss a little bit about why it's not the case with tuberous breast deformity and why we need to do other maneuvers, other things with the breast augmentation or a breast lift to reshape the breast. So what is a tuberous breast? Tuberous breast, like the name implies, is a formation like a tube. The breast forms like a tube instead of a round breast. Why? It's just a congenital malformation. So instead of the breast being wider, the breast parenchyma or the breast tissue constricts in the center of the chest instead of the entire area of the chest. So develops in like a constricted manner. So the fold is higher and usually the cleavage is wide. It's just everything is like centered in each side of the chest instead of being rounder. So what are other things that are very common with tuberous breast is that because it forms like in a tube form, the areola turns to be like large and puffy. It's just that the breast tissue is kind of pushing out, trying to grow in any direction, but it can't because it kind of constricts all over. So it pushes out and the areola tends to be wide and puffy. The other thing that is very common is that it droops and tends to be because that constriction grows like a tube and then droops. So droopy, high fold, wide cleavage, large areola, puffy areola, it's all very common with tuberous breast deformities. The other thing that is very common is asymmetric. So usually the constriction or the deformity, sometimes it's only on one side. So you have one side that is tuberous and the other one developed normally, or you have different degrees of severity. So what are the degrees of severity? And I put them here. They're basically 3 types of tuberous breast deformity. The type 1 is a very mild tuberous breast deformity that a lot of people have and you don't even know because you don't have all the telltale signs of a tuberous breast. It's just that instead of the cleavage go medially and almost touching the center of the chest, one side or both of sides is constricted, but only constricted in the center. Medial constriction of the breast. That's type 1. So the fold, it's kind of high, but it's only medially, and then laterally and centrally, the breast is normal. Type 2 is when it's both medially and laterally. So the fold, it's all constricted, but the breast tissue itself is not constricted. So it's kind of high, but still round. It's not acid tube. And type 3 is what we talked, is the severe form of tuberous breast, which includes everything that we talked. It's constricted medially, laterally, also around it. So in all quadrants, forms like a tube, pushes the areola out. So the areola is larger, puffy, and droopy. Okay, so how do we fix this? Okay, so a lot of people when they come to me, they're just like, I don't like the shape of my breast. It's always been like that. I don't like it. I think I need to put an implant in. And when I see them, like, you have tuberous breast deformity, and they're like, what is this, like a disease that I need to check? Is this? No, it's just your breast developed that way because of that constriction. And to put an implant, it's not going to fix the problem, okay? So the problem is usually fixed with a combination of sometimes putting an implant But the most important part of a tuberous breast deformity surgery is to release that constriction. If you don't release those constriction bands, you can put an implant, but then you'll have a tube over an implant, and the shape of the breast is not going to be improved, okay? So in order for the breast tissue to get the round shape and have the implant kind of reshape the breast, the most important part of this surgery is releasing the bands. So if it's a type 1 or a type 2, that it's only in the bottom, you can do the surgery through the areola itself. That's if you don't have any droopiness. If the areola is in the position that it should be in the center of the breast without droopiness, then you can do the surgery through a small areola incision or periareolar incision. Go in and then release the bands of the breast from the inside. So those constriction bands that are causing the breast to be in a tube, you kind of release them on the inside and then put the implant in, okay? Where to put the implant? This has two schools of thought, and it depends. For me, the decision depends on if there's any droopiness or not, okay? So to put it under the breast tissue, I think it gives the best shape, not under the muscle, because you released all those bands of tissue, and putting the implant there kind of works as a stent or as a hold of keeping the breast in the shape that you want, which is a round shape, okay? So you released all the breast, and now the implant is keeping the breast in a round shape instead of a tube over it, okay? So I think that's the best approach. If there is some droopiness and the constriction is not that severe, then I can put it under the muscle, release a little bit of the muscle, and that helps the nipple position to raise a little bit and correct that little droopiness. But that, we're talking about a very mild degree of ptosis or sagging boob. So that's only a grade 1 ptosis, and we can fix it that way without the need of a breast lift, okay? The majority of the breast tuberous deformities do have, like I mentioned before, a large areola. So in order to fix that, most patients need at least a donut type of lift. So the areola, the incision goes around the areola completely, and that helps decrease the size of the areola, release the bands on the inside, put the implant, and then you reshape the breast. Reshape the areola, decrease the size and the puffiness of the areola, and add the volume, okay? So that's the second option. And the third option for patients that are very droopy is a breast lift. When you do a breast lift in this type of patient, and this is a patient of mine with a breast tuberous deformity, and you can see the large areola. So basically the areola is almost the entire width of the breast. I don't know if you guys can see it. You can see it there, but basically the entire width of the breast has areola. So in order to reduce this, and the breast, instead of being round, it's more like a tube. And you can see the wide cleavage starts here and here, instead of when it's fixed with the breast lift, the cleavage goes up to the middle, the fold, I lowered it, the areola size is decreased, and the breast, instead of being like a tube, it's round. Okay, so with a breast lift, you have the ability to correct all the little things that are affected with a tuberous breast. The areola size, the areola shape, the high fold, the cleavage, and the shape of the breast. Okay, when to put an implant or not. So in her case, she had tuberous breast deformity, but she had a type of tuberous breast that had a lot of actual breast tissue, and she wanted to be smaller. So this is a perfect combination of, then you don't need an implant with this type of breast lift correction. The other thing to keep in mind is, because the areola is so large and you have to reduce it, the amount of skin I have to remove to do that is more. So most of these patients, the constricted type that need a breast lift and implant to add volume, not her case, other cases, and if you want to go with a big implant, then most of those patients are going to need 2 surgeries. The first surgery is going to be the reshaping of the breast to target all the things that I mentioned: areola size, areola shape, high fold, breast shape, and the cleavage. And then the second surgery will add the volume. You can add a small implant on the first surgery to keep the shape, but because you have to reduce a lot of the skin because of the large areola, putting a large implant is gonna keep the breast too tight, and then we run into problems. What are the problems of putting a too large of an implant when you do a breast lift? 2 things that are very dangerous. One is nipple necrosis. So the implant puts too much pressure and too much tension on the nipple, and the nipple doesn't get good blood supply. It turns dark and you can lose your nipple. So that's nipple necrosis after breast lift with implants. The other thing that can happen is that puts too much tension on the incisions, and the incisions open up. If they open up, then we have wound infection, implant exposure, we have to remove the implant, okay? So those 2 things are the most important things that I try to avoid when I'm combining a breast lift and a breast augmentation. The reason for it is tension, right? Breast lift and a breast augmentation are literally 2 surgeries that are opposites. With a breast lift, we're trying to tighten the pocket. We're trying to tighten the skin, reshape the breast. With a breast augmentation, we're doing the opposite. We're adding volume, tension in the breast. So we can combine them, but it all depends on the amount of excess skin that you have, your goals, okay? So with tuberous breast, because we're starting with a constricted breast, we can't really put up too much of a big implant on the first surgery. There's sometimes with a very severe form of tuberous breast deformity that they have almost no breast tissue, they have to expand the breast. Now when you expand the breast is with something called a tissue expander. Tissue expanders, if anyone has a family member with breast cancer may have heard of this, it's a type of implant that is not permanent, that you can put in. It has a little valve with a magnet that you can then inflate serially over weeks to months to create this space to then in a second surgery put an implant. That's called a tissue expander. So with a very severe form of tuberous breast that you're basically flat chested with a little bit of a gland, sometimes we need to reshape the breast with a tissue expander serially over weeks to months, create that space that it wasn't developed in the first place. Once the space has been created, then in a second surgery, you can go ahead and put the implant, okay? Again, this is very rare that a patient needs this, but I've had patients that have needed this just because of the severity of the congenital constriction of the breast, okay? What are the indications for surgery? Basically, it's if it bothers you. This is not a disease that it's gonna put you at risk of any cancer or any anomaly. No, it's just if you feel that you don't like the shape of the breast, if you feel that you can't wear the clothes that you want to, then there are options to fix it. But it's not a problem that we need to fix because it's going to cause another thing, right? When we hear tuberous breast deformity, like some people get scared. It's like, oh, I have a deformity. Like I was like, do I need to do anything? And am I at risk of anything? No, it's just like it developed that way. But other than the aesthetic improvement of the breast, there is no need to be scared, okay? And that's basically tuberous breast. Hopefully this answered some of the questions of some of my patients that are always like, do I have it? Do I need an implant or not? And I'll go ahead and take some questions now.
We have plenty.
Yeah, let's do it.
How long does a breast lift last for?
That's a very good question, and I don't know. So the answer to it is we don't really know. Breast lifts are a reshaping procedure and tightening. What are the things that are going to affect the longevity of the procedure? One is maintaining your weight. So if you change weight after the surgery, it's like, think about it as your own breast tissue, right? If you gain a lot of weight and lose it, then you're gonna have droopy breast afterwards because it kind of stretched the breast tissue. Same thing is gonna happen. This is reshaping the breast with your own skin. So even though I tighten everything, if you go ahead and then gain weight and lose it, the shape of the breast is gonna be affected. The other thing, pregnancy. Pregnancy, hormones that engorges the breast, breastfeeding, it all affects the breast tissue and the sagginess of the breast. So yes, that can affect it. And the third, and that's going to affect every single one of us, is aging, gravity. So gravity is going to pay a toll, and that's going to happen. How long is it going to take for the breast tissue to droop again? We don't know. What are things that are going to affect it? These three mainly, and also the fourth one is skin laxity. So if you are a person that has very thin skin with a lot of stretch marks, especially weight loss patients that the skin has been stretched to the limit and is very thin, usually that skin doesn't hold very well. And usually they have recurrence of the breastosis or sagginess fairly quickly after surgery, even a year after surgery. So what are the things, or what are the options out there to avoid this or try to prevent this and help this type of patient? It's called Galaflex mesh, or in like people have called it an internal bra. So it's basically putting a mesh under the breast, under the breast lift to kind of hold the lower pole and create an internal bra. So basically something holding the breast tissue. This mesh is absorbable, so it's nothing that is going to be permanent in your body. Your body's going to absorb it. It incorporates in a week, and by a couple of months is completely resorbed. But the good thing is, then it's like, if it resorbs, then where's the bra going? Like, then what's the purpose of it? The purpose is that it resorbs, but it leaves behind the scar tissue, that it's thicker and more supportive than your breast tissue, okay? So even though it's resorbable, it does leave that internal bra there.
Can you get a lift without implants?
Definitely. So when to do a lift with or without, this is a very common question. And another common question that I get is, do I need implants with a breast lift? My answer to that is always, it depends on your goals, okay? So a breast lift, this is a breast lift without implants. So a breast lift without implants is gonna tighten, reshape the breast, improve the nipple position, and tighten the whole pocket. Because it's like, basically, if I'm only removing skin and tightening everything up, it's still gonna look smaller. So if your goal is to keep your same breast volume, cup size, then you're gonna need an implant, okay? If you're okay with being smaller, then you might not need. The other reason to put an implant with a breast lift is the shape. So with time, the breast shape without an implant is gonna take its natural shape. At first, and this is 5 days post-op, is gonna look like this. Very round, perky, tight. With time, couple of months in, the breast is gonna take its natural shape, that it's flatter at the top, rounder at the bottom, more like a teardrop. That's the natural breast shape, and that's without an implant, that's what the breast lift is going to look like in the long run. If you want the look of an augmented push-up or cleavage look, then you're gonna need an implant with your breast lift.
Are implants safe? I hear about people getting them removed because they make them sick.
Yes, so you are talking about something called breast implant illness. So implants are very safe, but there is an entity called breast implant illness that has been it's been a lot in social media and in the news in the last few years, and it's related to breast implants. What is it? The problem is we don't really know what's the cause or what's going on. So it's not an actual disease that we can measure a blood work or see if you are at risk of. It's just a combination of symptoms that people have described related to implants. What are those symptoms? Symptoms like fatigue, general malaise, joint pains, weight changes, mood changes. So it's very non-specific general symptoms. There are a lot of patients that experience this after implants. The majority of those patients tend to have another cause, either autoimmune conditions, depression, other stressors in their lives that explains why they're having those symptoms. In a very small percentage of patients, they haven't had found any other reason, so they go ahead and have the implants removed, and 80% of those patients have had an improved in the symptoms. So there's still 20% that does not improve even after the implants are removed, which tells us that it might not have been the implant in the first place. So long story short, implants are very safe. Breast implant illness, it is out there. It is something to discuss. It is very rare. We don't really know if there is a direct correlation. But if you do have those symptoms, talk to your primary care, talk to your surgeon, so you can have an evaluation to see if there's something else going on or if you need the implant removed.
And invite them to watch your last video.
Yes, so the week before, Tuesday Tips was all about breast implant illness. So there's a video explaining all of this in detail and answering a lot of questions regarding this. So check out my page so you can see it.
Do you do rhinoplasty too?
I do. So rhinoplasty is a procedure that I do in males and females. It depends on your goals. Usually the type of rhinoplasties that I get are to reduce the hump and tip work, which is like the tip is a little bit bulgy or droopy and we can fix it. If you guys want me to talk about this in detail, I can definitely do a live coming up for rhinoplasties. Yeah.
Okay, doctor, how long take a mommy makeover procedure?
A mommy makeover usually takes about 2 to 3 hours. It depends on the procedures that you're gonna get. So mommy makeover means a combination of a breast procedure and a tummy tuck. The breast procedure, if it's a breast augmentation, then it's a quicker mommy makeover. If it's a breast lift with implants, then it might take a little bit longer, closer to 3.
Okay, next question. I'm getting a mommy makeover, but I want to fill in my hip dips. What's your top 3 reasons why not?
So usually I don't have enough fat. That's the first one. When I'm doing a mommy makeover, I have a limit of 1 liter of fat to be removed. So the number one reason is 1 liter of fat usually is not enough to give you a round, good shape to fill in the hip dips. Second reason, even if your goal for the fat transfer is the hip dips, I do transfer to the buttock. Why? Because if it's not gonna look round and unison. So it's gonna look like you have 2 balls of fat here and then on the side view kind of flattened. So to contour your buttock and hip area well, even though I'm not gonna augment the buttock a lot if that's not your goal, I do always inject in the buttock and hips to harmonize the entire hip buttock area. We're not looking at one area and the other. It's the entire torso, lower torso that we're contouring, and adding just to the hips, it does not look good. And let me think, the third reason is positioning. So positioning after a mommy makeover, it's hard because I'm gonna ask you to be bent over, and you're gonna be needing your hips to kind of move, and you're gonna have the 2 drains in. So adding fat transfer to that area, you're not gonna be able to protect that fat transfer area like I want you to, so you keep as much of the fat as possible.
Doc, do you repair deviated septum?
Yes, that's a very common thing or a very important area to address with the rhinoplasty. So rhinoplasty, usually it's a small incision here in the columella or the middle of the nose here. And then on the inside, if the septum, I usually use the septal cartilage to reconstruct, to add to the tip, to improve the dorsal aesthetic lines, which is these lines here in the tip and the top of the nose. So usually I remove the septum and use that cartilage. So if you have a deviated septum, that's going to definitely improve, because the cartilage, I'm going to remove it and use it for something else.
Okay, this is the same person. She asked, as a surgeon, will you personally have plastic surgery?
Don't tell anyone, but I already had. So yeah, I had liposuction a couple of years ago, and if I'm doing this, it's because I believe in it, and if I believe in it, then yes, I'll do. I had done it myself, and I just had a baby, as you guys know. So let's see how my body recovers, and let's see if I need something else. 6 months. I'm waiting the 6 months.
Oh, yeah. Can you give me? Well, can you give me tips if I don't have any fat, and how do I know that I have enough fat?
So one of the things that help you assess if you have fat available is your BMI, your body mass index. That's a number that you calculate. You can Google it, BMI calculator, and it uses your height and weight to give you a number. So if you are under 20, that's usually a sign that you don't have fat. You're very thin. So my recommendation is going to be gain weight. BMI of at least 21 is good for a BBL. It's probably going to be a skinny BBL because you won't have a lot of fat, but at least with a BMI of 21, we can do a recontour that's going to look very good. But less than that, you're not going to have enough fat to actually see a difference.
How soon after giving birth is it safe to have a mommy makeover?
So I always ask my patients to wait at least 6 months. Why? Just think that your body expanded and grew a human being for 9 months. You have to give it time for the skin to contract, retract, your muscles to settle, your breast tissue to settle, to see what actually do you need. Because the first week postpartum, I saw my belly, it's like, I'm gonna need a tummy tuck for sure. And now it has retracted a lot. So if your body changes, and you have to give it time. So at least 6 months. And if you're breastfeeding, your breasts are gonna be engorged, and you still don't know how much breast tissue you're gonna have left behind and how much skin excess you're gonna have. So we don't really know if it's a deflated that's gonna be fixed with a breast implant, or is it deflated that you're gonna need a lift. So wait 6 months after finishing breastfeeding so we can see what type of breast procedure is best for you.
The last one.
Yeah.
Must suggest add-on for mommy makeover.
The most common one, arm lipo, I think, or face side chin. Those two are like there. But excisional procedure, brachioplasty, or arm lift, that we can combine with a mommy makeover. But most commonly, a little bit of lipo here in the arms, or reshaping of the neck with liposuction and face tight. Face tight is radio frequency energy. So in the area of the shin, I almost always recommend face tight when we're doing liposuction to the shin, because the skin of the shin is very thin. And even though you think that the bulgy it looks bad, imagine an empty sack of skin hanging. That looks worse. So adding the face tight is going to help with the skin tightening and help with the contouring of the neck a lot. So the majority of times I recommend, when you're adding shin lipo, consider face tight chin.
And can I do both? I imagine the arm and the face.
Yeah, those two things you can combine with a mommy makeover, because the amount of fat to be removed from the arms and shin is usually not that much. Even though you think that in your arms you accumulate a lot of fat, you really don't. So it is something that you can add with the mommy makeover. Awesome, guys. Thank you so much. I love the questions. I hope you guys enjoyed the topic, and prepare for next week. Next week, it's going to be another month, so we're going to be talking about something else, no breast, because we have talked about breast a lot. So we're going to change. We're going to change topic for next week. I'll see you guys.